This is a Fox News Alert. I'm Brett Baer. Big news on the small number of people across the country who successfully signed up for Obamacare. Chief National Correspondent Jim Engel is here live with the news breaking late this afternoon. Hi, Jim.
Hello, Brett. Well, industry sources tell Fox that by last week, only about 50,000 people had signed up for the federal exchanges under Obamacare, putting the administration far behind its goal of 500,000 or so in the early days, 7 million by early next year. And that further complicates efforts to fix another problem. The administration is desperately searching for some way to help people whose policies were canceled. But how do you unravel the chaos created by 4 million cancellations? At the same time, the administration is trying to sign up 7 million uninsured.
Well, all of a sudden, the interest in delaying or putting off Obamacare has become bipartisan. So you have Democrats and Republicans. Everybody knows we're not ready to do this. Lawmakers have suggested several options: extend the enrollment period, delay the mandate for a year, or delay the entire law for a year.
Take another year. Everybody catch their breath. Let them stay on the old plans, and we can continue to fight about this in 2014.
If you delay the individual mandate, you must delay the mandated new coverages that begin on January 1, 2014. You can't mandate all of these new benefits and not have those healthy young people come in the system to help pay for those benefits.
The Obamacare program cannot sustain itself if we don't get lots and lots of healthy people signing up. And if the administration just suspends the mandate, they're guaranteeing that they've got a financial catastrophe.
Because it needs healthy people to pay more to cover the costs of those who are older and sicker. The main focus of fixes would be to help those the president acknowledges were hurt by the law, which resulted in the cancellation of millions of policies. But undoing the damage that's been done will be difficult for insurance companies.
They have put all the cancellations through and eliminated those policies the way they were required to do by law. You can't just hit the reset button here.
He says it'd take about 6 months to reinstate policies under the state regulations which govern them. One official floated the idea of higher subsidies to reduce the sticker shock, but like other options, that would have to go to Congress.
I think you do need a statute to do this cleanly and fairly for everyone.
Even if the subsidies were raised, the problem now is that the website isn't working well enough for most people to see any numbers. And of course, the president would have to backtrack on yet another pledge that Obamacare wouldn't raise the deficit by a penny. Brett?
Jim, thank you. In his re-election bid, President Obama's campaign slogan was forward. It still seems to be the goal. Forward from the shaky rollout of Obamacare's broken website, broken promises, and cancellation notices to work on other policy goals. But that's much easier said than done. White House correspondent Wendell Goler explains.
White House officials have withheld comment on a New York Times report that the president said privately of the problems of healthcare.gov, quote, "If I had known, we could have delayed the website." Mr. Obama is trying to avoid being a prisoner to bad news about the Affordable Care Act rollout, as he was during the effort to contain the Deepwater Horizon oil spill. Last week, he aimed to expand the conversation, speaking about improving America's ports and other infrastructure and enlisting business leader support for immigration reform. But with healthcare.gov still not working as well as it needs to, and his own comments about what was arguably Obamacare's central promise.
I am sorry that they are finding themselves in this situation based on assurances they got from me.
The president is finding it difficult to change the subject. House Republicans will grill another Obamacare official this week, asking why a website that cost hundreds of millions of dollars didn't work.
I want to know why we were promised a state-of-the-art website and we got an abacus and a sundial. I want to know what we got for our money.
Former White House Chief of Staff Leon Panetta, who served as Mr. Obama's defense secretary and head of the CIA, says the mistake was trusting the Health and Human Services bureaucracy.
You cannot rely on the bureaucracies to do this kind of work. They're not the ones that really have the capability to, in fact, get this done.
Larry Summers, Mr. Obama's former chief economic advisor, sees lasting damage. He says even if the website's fixed by the end of the month, quote, a shadow has been cast on the federal government's competence. Meanwhile, Obamacare is looking less like a vote-getter for Democratic members of Congress up for re-election in 2014, though the head of the Democratic National Committee believes there will be better news by then.
I think, actually, Candy, that Democratic candidates will be able to run on Obamacare as an advantage leading into the 2014 election.
Still, Republicans say they'll be happy not to change the subject.
This issue is going to be toxic for the Democrats, and believe me, we will tattoo it to their foreheads in 2014.
Democrats say running against Obamacare didn't work well for Republicans in 2012, but the 2014 requirement that people buy health insurance if they can afford it may focus more attention on it. Brett?
Wendell Goler live on the North Lawn. Wendell, thank you. A bit later on, President Obama shows regret not just about missteps in Obamacare, but about government bureaucracy and big government ideology. But first, stocks started the week mildly ahead. The Dow notched its third record of the month, adding 21 points. The S&P 500 was up 1. The Nasdaq gained a half point. The damage in the Philippines is far worse than expected. Estimates of 10,000 dead, 600,000 displaced by Typhoon Haiyan, a storm of nearly unprecedented power. Wind gusts topping 175 miles per hour, and huge waves swept away entire villages. In the hardest hit city, the Interior Minister said, quote, all systems, all vestiges of modern living, communications, power, water, all down. And a medical student tells Reuters people are like zombies looking for food. It's hard to wrap your mind around that kind of devastation. And on this Veterans Day, we honor America's veterans for their patriotism and sacrifice. Were on display in full measure where help is needed more than ever in the hard-hit region. The U.S. military sent Marines and sailors to the scenes of almost unimaginable death and destruction in the Philippines. The government is organizing emergency shipments for temporary shelters, food and hygiene supplies, and late this afternoon, we learned the aircraft carrier USS George Washington and other U.S. Navy ships are also on the way to help. First responders and international aid groups are doing all they can, but things are really bad. Correspondent Claudia Cowan takes a closer look at a situation that seems like it's only just beginning.
The destruction and loss of life brought on by the typhoon known simply as Yolanda in the Philippines is massive. 3 days after the storm made landfall, bodies still lie in the street. Homes are gone and much of the infrastructure is destroyed.
A disaster of this magnitude can quickly overwhelm any force, really any government.
U.S. Marines are here with supplies and air support.
I've got airplanes and helicopters. I've got airplanes that can look for people in areas that are stranded.
The Filipino president says more than 20 countries have pledged aid. In addition to the Marines, Secretary of State John Kerry promised a full commitment from the U.S. That commitment echoed by President Obama, who reminded the Filipino people that their spirit and resilience will see them through this tragedy.
I tried to reach him, but there's no reception, and he just kept on telling me, I can't hear you, I can't hear you.
Stateside, as those with loved ones in the Philippines wait for news about the whereabouts of those still missing, a number of humanitarian groups are working to raise funds and gather necessities like medical supplies. Here in the San Francisco Bay Area, the tight-knit community of more than 600,000 Filipino Americans are doing their part as well.
Just seeing the pictures is pretty devastating, and I can't imagine what people are going through right now.
But for those who survived this storm, the long road to recovery will be painful and take years. The economic impact may top $14 billion, and the death toll of 10,000 is still just an estimate.
My only call is to stay calm, to keep praying, keep helping, and stay united.
It is a waiting game for many in the Filipino-American community here. Some are holding out hope they'll get that call saying their loved ones are safe. Others relying on Red Cross volunteers on the ground to find and locate those who are still missing. Brett?
Claudia, thank you. Up next, a deal but no breakthrough with Iran, a report and analysis from Britt Hume. But first, here's what some of our Fox affiliates across the country are covering tonight. Fox 23 in Tulsa is covering the deadly plane crash involving Oklahoma Senator James Inhofe's son, Perry. He died when his small plane crashed in Owasso, Oklahoma on Sunday. He was an orthopedic surgeon. WTVT in Tampa is watching the bullying scandal involving the Miami Dolphins players. Perhaps it takes some of the spotlight off of their last-place Bucks. Miami plays Tampa this evening during Monday Night Football. This is a live look at WTXF from our Fox affiliate in Philadelphia. The big story there tonight, a man shows up at the Philly airport and is told someone already flew somewhere earlier that day using his identity. They're looking into exactly what happened there. That's tonight's live look outside the Beltway from Special Report. We'll be right back.